inseparable from issues of racial inequity. I mean, there's just no time untangling the reality that child poverty and the rate of child poverty that we have in our community is in large part directly a result of just decades and decades and a long history of discrimination across the board: housing, employment, criminal justice. Because the stats for the city are dramatic. I mean, for African Americans, they're even more severe. The rates of poverty are even more.
How do you reconcile the previous learning with this learning?
That people are working?
No, the
That's widespread.
Majority of poor people are white.
It's widespread. The majority across our entire region.
Okay.
Right? For Hamilton County, for the city of Cincinnati, it's still majority African American. Right? It's affecting by rate wise. It's predominantly by numbers wise. It's affecting everybody. But the rates are so much higher in the African American community because of these long histories, right, that we have not yet overcome around, especially in the criminal justice system, certainly employment and housing across the board. And this is why the state of Black Cincinnati shows what it does. That, from 20 years ago, all the disparities are, if not the same, greater on every single measure between white and Black Cincinnati. So we can't separate these issues, especially even because the majority of children in poverty are in a single female-headed household, right? And actually, some of the research from RAND that was even more troubling was that Cincinnati, compared to comparison cities, it's hard to if I can explain it right. If you look at the poverty rates for African American women in the city of Cincinnati compared to the same groups in other cities, they're worse off here. Worse off here. It's not just that the rates are high here, but they're worse off here than Charlotte and Raleigh and other competitive cities. So, in other words, we have to deal with these issues together, right? We have to deal with issues around race if we are going to get at some of the root cause issues around poverty. Fourth, and again, this might not be news to some of you, but the impact of poverty on children is traumatizing, right? And the scientific research behind this is really compelling and really devastating. And a lot of the research that we looked at around something called ACEs. Anybody heard that term? Adverse childhood experiences. It's unbelievably powerful that the number of these experiences, going days without food, experiencing domestic violence in your home, having a parent incarcerated, there's a series of adverse childhood experiences. And the more that a child experiences in the earliest of years, the more, even 20, 30, 40 years down the line, direct correlation to even instances of heart disease, of cancer, all based on what happens in the first, most formative years of the child's life. We know that these few years are so critically important. That makes the imperative so much more so that we got to figure out how to change the trajectory and expand opportunity for families with little kids, because that's when the gaps and that's when the trajectories are set, right? So I think that was really powerful for a lot of people to really, again, understand the severity of the impact of poverty on children. And again, it's about the household, it's about the parents, oftentimes about what the mother is experiencing. If we want to long-term help break the cycle. The fifth kind of insight is that, and this is not earth-shattering, but it's complex, right? We want to jump to the simple solutions. It's just about jobs. It's just about affordable housing. It's just about fixing Metro, right? Yes, all of that. It's all of that. But I think a lot of people really recognized how deeply complex this is. That's going to really require two things. One, a long-term effort. I mean, a decade. I mean, it's taken us decades to get in the situation. It's going to take a generational kind of commitment to address it. And we've got to think about this on a systems level, right? About all the kind of component parts and the things that need to be integrated on multiple fronts for us to actually make a difference. It's not one key driver that is leading us to the situation, and it's not one silver bullet solution that's going to get us out of it. So, which really calls all of us, and this has been really powerful for us, even at United Way, to think about what we all need to do differently. Employers.
Must have been for United Way to actually think about changing.
Yeah. Now I'm going to come to that. To think about what do funders do differently, what do nonprofits do differently, what do employers do differently, elected officials, government administrators. We all have to do things differently. Pat?
To illustrate the complexity, I thought that diagram that was used in that
The map, the system map,
was very helpful because it really began to get at that issue.
showed how intertwined all these issues are. Because on some, again, it'd be so simple to say poverty is a measure of income. We get people more money, solved, right? Certainly that's part of it, but that has a lot. There's so many. I'd be happy to send that back out if you'd like. It was really powerful tool for us to really think on a much broader kind of systemic level around this issue that I think opened the leadership of the collaborative's eyes to that might have started this thinking it's just about jobs, it's just about skills training, it's just about preschool, right? And yes, it's about all of that. It was a really powerful tool. Thank you for that feedback. So that kind of sums up. I mean, a lot of insights built into all of those and learnings, but it sums up, I think, on the whole, how we've thought about and summarize what we've learned and heard from the community. So what we do about it is the next, obviously big question, and we've set a direction and are now working on acting and implementing against a couple of these areas. But like I said at the beginning, this has got to be an iterative process, right? It's not like, all right, here's the game plan, let's execute, and hopefully it works 5 years later. We got to test, small test, and learn and measure impact and really learn as we go and keep engaging the community throughout. So. Let me step through the 5 kind of commitments that the collaborative has made and to share an update with you on where it stands. And I kind of think of it, the commitments falling into 2 buckets. One is kind of the here and now. What can we do? What can nonprofits that are working with families right now do better to help families get ahead in the next 5 years, near term? How do we improve the system of support that's largely broken for families in poverty to help them achieve their own goals and dreams and help them reduce barriers. Then there's a whole other kind of strategy set that's about the system work, right? The larger issues, the policy issues that we have to address, or we're always going to be in the situation, right? So, and we view them as equally important, and that we have to move on both the near term and the long term, or it's going to be insufficient. So. On the near term, you might have heard at the last summit, we talked about this one-to-one idea. The idea is let's bring together, and we're convening it right now, all the organizations, all the nonprofits, many that you know that are working in some way with families in poverty right now, that are doing coaching or support or case management, and let's pull them together, figure out and standardize what we're doing, agree on how we should measure our success, because nobody is measuring, are we actually over time helping families move out of poverty? Nobody tracks that. And the war is held accountable for achieving that kind of outcome. So let's agree on what we're going to measure, the practices that we're going to use. Let's collaborate and better coordinate our services, and collectively really work with over time. Because part of the challenge is that so many, and this is because of funding, so many services are so kind of transactional and limited in addressing a very specific need of a child or an adult, but not based on what the family actually wants or needs. So we've used this term family-centered, really putting the family at the center, building off of their own dreams and aspirations and strengths, not their deficits necessarily, and helping coach along the way. And sticking with them, years, not weeks or months, years to help them access any support that they need, help them access services if they need them, but really bolster their own ability to meet.
Is that the mentors I've heard about?
Yeah, we've thought about how to bring mentors or coaches, either paid or volunteer. We want to test all those approaches.
Yeah.
As to what might help, what might work. So that's that's the most direct way in the next 5 years that we want to actually work directly with and track the progress of 5,000 families that we've committed to helping them move ahead. But importantly, it's got to start with the family at the center, leading the way, not the typical, honestly, social service approach, which is trying to address deficits and where people are broken.
Although some social service agencies have always called themselves family centered, so somehow.
You got to get really clear about what we mean.
They understand what that means.
Yes, I know that. We always get that. Oh, we do that. We do that. We move families out of so that's one. So second, on the policy side, because again, we all know and recognize that our efforts are going to be limited. There's no amount of, frankly, there's no amount of coaching that we can do if we don't address the larger structural issues that's going to substantively change this trajectory, right? And if you think, again, back on the scale of the challenge and the numbers across our region, 600,000 people, right? Social services aren't going to cut it. And we have to address some of the larger policy issues. So, and we laid out in the last summit the key areas that we heard time and again from the community and that we learned from the research were the key drivers that we have to address. And the frame is also what do we have within our sphere of influence locally, right? A lot of this has to do with federal policy that we are going to have very limited ability to impact. Some of it's state that we can have a role in influencing, and some of it's local. But a lot of the social, yes, so certainly state is in play and local. But a lot of the federal, social welfare policies and how benefits are structured, how cliff effects happen, a lot of that is based on federal policy, and who knows what's going to happen there. But what we think we can have an influence on are in a couple of key areas. One is around child care. Obviously, the preschool promise was a good effort in that direction, but there's more work that has to be done to make child care, not only because of the impact on the kids, right, on helping to set them on the right path, but as a work support to help people get back to work, right? If you can't afford or have access to child care, it's a huge challenge. And right now, the state has made some effort to smooth out what's called the cliff effect, in terms of when you make more money, you lose benefits. They've smoothed it out in terms of the child care subsidy, but it's much harder to get onto it. So I don't want to get too technical, but if you're above 100, I think it's 38% of poverty, so you're not self-sufficient is the point. If you're above 138% of poverty, you don't get child care subsidies, right? If you get on before then you're eased out well beyond 200% of poverty. But if you're at 140%, again, you're working poor, you're not self-sufficient, you can't afford $10,000